Welcome to Easy Medicine channel. Today I start the topic that are the antidiarrheal drug. So today I discuss about the antidiarrheal drug, what is the antidiarrheal drug and the types of antidiarrheal drug and mechanism of actions of every types of antidiarrheal drug and their use, side effect also. So let's start the topic. So, before starting the antidiarrheal drug, we want to know what is diarrhea and causes of diarrhea. So, what is diarrhea? Diarrhea is too frequent passes of liquid stool, but according to WHO, these definitions are more specified. So, according to WHO, diarrhea denote the passage of unusual losses of watery stool at least 3 times or more in 24 hours. So, according to WHO, greater than 3 times passage of loose watery stool is called diarrhea. So, when a person passes of unusual loose or watery stool at least 3 or more than 3 in 24 hours, that's called diarrhea. And the diarrhea based on the pattern of onset, diarrhea are 2 types, that are acute and chronic. So when the diarrhea persists 2 to 3 days, that's called acute, and when the diarrhea persists greater than 2 weeks, that's called chronic. And acute diarrhea occur mainly due to infection, but chronic diarrhea occur mainly due to the irritable bowel syndromes and malabsorption. So, diarrhea denote the passage of unusual loose or watery stool at least 3 times or more in 24 hours, and this diarrhea are 2 types according to the pattern of onset, that are the acute and chronic. When the diarrhea persists 2 to 3 times, that's called acute and it's occur due to the infection, and when the diarrhea persists greater than 2 weeks, it's called chronic and it's occur mainly due to the irritable bowel syndrome and malabsorption. So I think you all are understand what is diarrhea and the types of diarrhea. Now I tell you all about the causes of diarrhea. There are mainly 4 reasons for that diarrhea can occur, and I will discuss every cause of diarrhea. First, infection. These are most important cause of diarrhea. So, due to the take of contaminated water or other reason, when the infection can occur in our body, for that diarrhea can occur. Second, toxic. So, when some toxic agent are ingested in our body, for that diarrhea can occur, and these toxic agents are ingested by the infection or any type of fast food. Third, most important, that is anxiety. In our daily life, there are various reasons for that we suffering in anxiety, and when we suffering anxiety, our urine and stool formations also increase, and when the stool and urine formation increase, it also increase the evacuation of the stool. So due to anxiety, diarrhea can also occur. Fourth, drug induced. When we ingest some types of drug, it can also causes diarrhea. So these drugs are ampicillin, colchicine and magnesium sulfate. So there are 4 reasons for that diarrhea can occur. First, infection. Second, toxic substance. Third, anxiety, and fourth, drug induced. In first reason, infection can occur by the virus and also occur by the bacteria. And in virus, rotavirus, astrovirus and coronavirus are most important, which can causes diarrhea. And in bacteria, E. coli, salmonella and cholera are most important bacteria which can causes diarrhea. So I hope you all are understood about the causes of diarrhea. Now I discuss most important thing about the diarrhea, that is how the diarrhea occur in our body. That means pathological cause. First, increased secretion by the intestinal mucosa. So due to the etiological factor like infection, toxic substance, anxiety, or drug induced. When intestinal mucosa secretion is increased secretion by intestinal mucosa, so water is increased in intestine, so this increased water mixed up with stool and patient or person can pass watery stool. So due to the etiological factor, intestinal mucosal secretion increase, for that water is increased, and this increased water mixed up with the stool and person passes the watery stool. Second, increased luminal osmotic load. So when the intestinal luminal osmotic load increase, that means lumina attack the water in surrounding place and retain water in lumen. For that, increase water in lumen. For that, this increase water, for that more amount of water mixed up with stool, so person can pass watery stool. So when the intestinal luminal osmotic load is increased, lumina attack the water in surrounding place and retain water in the lumina. So increase water in the lumen, so more amount of water mixed up with the stool and person can pass the watery stool. Third, decrease water and electrolyte absorption in lumen. Listen carefully about this point. Decrease water and electrolyte absorption in lumen. So let's describe about this point. Normally, lumen absorb particular amount of water and electrolytes, but when lumen decrease water and electrolyte absorption, that's mean more amount water present in colon, so more amount water mixed up with stool, so person can pass watery stool. So normally lumen absorb the particular amount of water and electrolyte, but when the lumen decrease the water and electrolyte absorption, that's mean more amount of water present in the colon, and this more amount of water mixed up with the stool and person can pass the watery stool. Next, inflammations of mucosa and exudate in lumen. So inflammations of mucosa and exudate in lumen. So when due to etiological factor, inflammation can occur in intestinal mucosa, some amount of exudate present in lumen, so some amount exudate or pus and fluid mixed up with stool, and person also pass this mixed up watery stool. So there are 4 pathological reasons for that diarrhea can occur. First, increased secretion by the intestinal mucosa. Second, increased luminal osmotic load. Third, decreased water and electrolyte absorption. Fourth, inflammations of mucosa and exudate in lumen. Now I tell you all about the approach or management. So when a person has suffered with diarrhea, what can we do? We can give replacement therapy of fluid and electrolytes, and we can also treat the cause of diarrhea. And last, most important, that we can give antidiarrheal agent. That is the main topic in today's class. So now I start today's topic, that is the antidiarrheal agent. So I hope you all are understood about the diarrhea and the cause and pathological reasons. So let's start the antidiarrheal agent. Antidiarrheal drugs are mainly two types, that are the non-specific and other is specific. And these non-specific antidiarrheal drugs are also divided in three types, that are the oral rehydration, anti-motility, anti-secretory. And in specific, that are two types. And the specific antidiarrheal drug also two types, that are the antimicrobial and probiotics. So the antidiarrheal drugs are mainly two types, that are the non-specific and specific. Under the specific antidiarrheal drug, there are mainly three types, that are the oral rehydration, anti-motility, anti-secretory. And under the specific, there are mainly two types, that are the antimicrobials and probiotics. And in next video, I will discuss about each topic one by one. And today I in this class, and I hope you all are understood about the topic. So thank you for watching this video, and please share and subscribe my channel.